Yeah, I know I've been interviewed by a couple different people, legal actually attorneys, about, they wanted to know if I've ever refused a prescription based on off-label use. And I can honestly say, in the almost 30 years I've practiced, I never have. And usually you don't even ask what it's for necessarily. I mean, if you talk to the patient, but the government did a good job of dividing us, and
Yeah, they did.
they really did,
And
and I think that was
and it was
part of the
so
plan.
yeah, it was so unnecessary. I mean, we're
Yeah,
colleagues, and
right.
we both bring expertise and an objective to the table that is so important in 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 managing patients. And it was dumbfounding to me. It still is. This is not contrived. I still can't fathom. And it certainly wasn't the majority, but it became a significant percentage of pharmacists. But to be fair, some of them have been threatened by their state pharmacy boards.
Yep.
And there was also I think there was some corporate pressure for those that work for corporate pharmacies. And so, to be fair, but I also have to tell you, and do unto others you'd have done unto you. If I were in their shoes, I would have said, no, I'm not doing that.
Yeah,
I'm going to fill these prescriptions.
I agree, and I am glad that you did defend them a little bit in saying that, the state boards of pharmacy were coming down on them. We got a letter in Washington State saying that if we see inappropriate prescribing, we're supposed to turn people in, and us, and of course, the same thing happened with doctors. I mean, there's a lot of your colleagues that they worked for big clinics and they just rolled over too, even if they didn't agree with it
Oh yeah,
necessarily personally.
and there were physicians in hospital systems, and if they saw a pulmonologist or intensivist, and this has happened many times, and physicians have lost hospital privileges and board certifications and licensures and all this stuff because their colleagues turned them in for what they were doing, treating patients in the hospital and outpatient as well. And it's yeah, they divided us, and the patients are the ones that are ultimately going to suffer for this. And I've heard the argument, and you and I both know there are providers out there, physicians, and that, for example, have inappropriately prescribed narcotics. I've seen it, and I've personally reported it. Uh, uh, Actually, several times I've reported inappropriate prescribing of narcotics. I'm sure you've done the same, and refused to prescribe, or excuse me, to fill prescriptions
Yeah.
that you felt were not appropriate. And that should absolutely happen. But in the face of a novel virus, and again, as Dr. Redfield said, it was antithetical to science what they were doing to us, and it was antithetical to the practice of medicine what they were doing to us. So yeah, tough times, man.